and then we can get started. So before I start, I would like to begin today by acknowledging the traditional custodians of the land on which we meet today and pay my respects to their elders past, present, and emerging. I extend that respect to Aboriginal and Torres Strait Islander people here today. So as I just mentioned, we're going to be talking about how to use your plan appropriately, or a loved one, or if you're a service provider or a support coordinator, then your participant or client. So when a participant receives their NDIS plan, it can be really confusing to understand, especially because the NDIA don't necessarily give you a lot of information when it comes to implementing the plan. They think they do, but they just kind of skim over things. So it can be really super confusing. Can also be confusing about what category can be used for what, where it's flexible and where it isn't. What does the phrase choice and control actually mean? And what to do if the plan is not built in that way that works for the person. It's also hard because when you have the meeting, you're talking about the supports that you need and everything, and then you get a plan back and it's not really specific. So you're like, what can I use it for? So today I'll talk a bit about those things, and hopefully you feel a bit more comfortable afterwards. But as always, if there's anything that I haven't answered, you can always submit through the Fighting Chance website any questions, and that comes to me and also the other support coordinators at Fighting Chance, and we can absolutely do our best to help if we don't know the answer, and we don't know everything, but if we don't know the answer, we do know a lot of people who have a lot of information, so we can always go and ask and come back to you. So key things about an NDIS plan is what I'm going to start. So some key things to be aware of when reading your NDIS plan. And I've written this PowerPoint based on my experience with people, working with people when they get their plan back, the questions that they tend to ask or the things that they tend to be confused about. So that's kind of how I've put this together. But please just, if there's anything I'm missing, just ask me. So your NDIS plan will be broken down into 3 sections: about me, my goals, and my supports. The About Me section is based off the information you provided the LAC. Oh, and of course, the bottom section will be the funded supports, but I will just start by talking about the top bit. The About Me section is based off the information you provided the LAC or planner in your meeting. A lot of people say that when it comes back, they go, oh, but that's not exactly what I said. Don't worry. If it's really bothering you or your loved one, you can ask them to change it, but it doesn't impact your funding. So you don't need to worry so much about it. But if it is just like really getting to you, you can ask for it to be adjusted, and they should be able to do that fairly easily. Well, I know that they can do it fairly easily. They might push back a little bit. Something to do that can help with that is you can actually write that About Me section and give it to them. So in the exact words that you want it to say, and you can provide it to them. So that About Me section, they want to hear, it doesn't need to be a page long, but just a brief summary of where you live, who you live with, what are your kind of main sort of informal community and mainstream supports that are around you and mean something to you. What do you do day to day? It doesn't need to be, hour by hour or anything, but just roughly during the week, this is what it looks like. On the weekend, this is what it looks like. What do you enjoy? And what are some things that are important to you? That's sort of what that summary is about. If there's anything that you want that's really important to you that you want to include, there's the opportunity to include it there, but it doesn't impact your funding. The next bit is the goals. Actually, the supports come before the goals, but we'll talk about the goals. So the goals are really important. So when you look at legislation, and I know I'm jumping ahead a little bit here, but when you look at the NDIS legislation, particularly section 34, reasonable and necessary, how they build a plan and when the funding is in your plan, how you can utilize your plan within the guidelines, but it really comes down to that reasonable and necessary part of the guidelines. One of those points is the support must link to one or more of your goals. So when you're thinking about your NDIS goals, it's really important to keep them really broad. And they liked people to have SMART goals so that they're specific, measurable, timely, achievable. So you can have a think about that prior to the meeting. And there's a booklet too on the NDIS website. We'll put it in the resources that we share with you with this webinar. But you can use that to have a think about the goals, and the LAC or planner is there to help you adjust them. But my tips would be keep it really broad. So for example, you could say you wanted to be, or your participant or your loved one wanted to be independent with showering or with dressing and personal care tasks. But there's also things in the community that your person wants to be independent in, and other things at home. So having a goal around, during this plan period, I would like to build my skills or have access to the supports to build my skills and capacity to be more independent or maintain my independence, or, build my capacity both at home and in the community. By keeping it broad, it means that when you have the funding, the package back, and you've got, say, core supports, and we'll go through this, and capacity building supports, so therapy supports, you have more flexibility with how you utilize the plan, because you can fit a whole lot of smaller goals under a really broad one. So you don't need to achieve that goal in that plan period. You can say you're working towards it, and your therapist can make small achievable goals with you in therapy based on what they are working towards with you. So it could be specific to showering, specific to eating independently, or specific to travel training or something like that, helping you build your independence in different areas. But if you're really specific in a goal, it just means that it's going to limit how you can utilize the funding. So it means that if you say, that you want to be independent in showering, then the support that you use can only be for showering, for building your independence for showering. But if you think about the showering task, there's lots of things. You want to be able to shower at the right time. You want to be able to shower regularly. You want to be able to shower properly. You want to be able to shower with taking an appropriate amount of time to shower, not an hour and a half. So there's lots of things that come under that, whether that's cognitive, physical, time management, lots of things, skills that can be built around being able to shower independently. But also there's a number of things that you can do that you can also become independent in if you've got a broad goal. So that would be my tip. It's important to really think about the goals. You can have as many goals as you want, but there is no, I would say that 3-4 goals, 6 max, is pretty reasonable, because you want to ensure that the goals aren't repetitive either, that they're broad enough, but also that they are what you realistically, or your person realistically, is going to work on in that time period. And then the supports. So the support section is your informal, mainstream, and community supports. These do not include any funded supports or anything that can be funded. So if it's your first plan, then the funded supports, so allied health professionals like speech therapists, physio, OT, psychologists, exercise physiologists, personal trainer, dietitian, all of those podiatrists, all of those people can be funded. So we wouldn't put them in this section. They would be requested supports for it to be funded. But if you are seeing a psychologist through mainstream, so through your mental health care plan, then that can be included here. And you're not going to see them through NDIS. And then you want them to be supports in there that are important to you, that help you, and that are a part of your circle of support. But if you kind of look at it and go, oh, they didn't include the OT or they didn't include that, that's just why, because they only include people who are informal, mainstream, or community. What they mean by mainstream are doctors or specialists or sort of like dentists and people like that are kind of medical, as well as TAFE, uni, school, Centrelink, any of those sort of mainstream services. Community supports, what they mean by that are things like church or any gardening or social groups that you're a part of in the community. It can also be, there's some community programs out there, so it could be one of those. So that's what they mean by that. And then when we come down after you've got the about me section, the supports and the goals, you come down to the funded section. So it will say your plan dates, and it will say the total amount, and then it will break it down into 3 areas. So you've got core, capacity building, and capital. Most plans have core and capacity building in them. Capital, it just depends if the person needs it. But core and capacity building are the main 2 that are in the plan. So I'll start with talking a bit about your core budget. So the core budget has always been the most flexible. But not all parts of core is flexible unless there is funding in that subcategory. So I know this gets a bit confusing, but I'll try and explain it as best I can. So under the core budget, there's going to be a number of subcategories. We don't necessarily see all of the subcategories that are under a budget amount, because it's sitting in the background in the system. But the subcategories are, the main ones are consumables, daily activities, social and community civic participation, and transport. Home and living has also recently become a subcategory. So if you've got home and living supports, it was originally for SIL and ILO or flexible core. It wasn't originally put in your daily activities budget in that subcategory, but now it's put in its own home and living budget. What I mean by flexible, unless there's no money in there. So consumables, daily activities, whatever the subcategory, can have whatever amount in there based on the NDIA making a reasonable and necessary decision on what they believe the person requires. The flexibility part of it is if that subcategory has, so say consumables has $500 in it, daily activities has 40,000, social community has 20,000, and transport's a little bit different. But if transport is not a periodic payment, then it can be used flexibly between the budgets. But if you need more than $500 for consumables, you can take from one of the other subcategories in core, as long as they are all managed the same. So when it comes to transport, if it's not a periodic payment, which is a set amount that goes in every fortnight, depending on the level of transport, 1, 2, or 3. 1 is when you don't necessarily have anything on during the week, but it's there as it's there to contribute to the transport cost, so that's not a barrier. Level 2 is a bit higher, and that's when you work or study or go to a day program part-time. And level 3 is higher again, and that's for full-time. they're always considered to be contributions. That's not a massive amount of money. If it's periodic, it will be going into your account every fortnight. If it is plan or self-managed or NDIA managed, then it's the amount sitting there, and then you claim the invoices the way that you would the other budgets that you use. So then there's more flexibility within utilizing the transport for more than what is in there. But if say consumables doesn't have any money in it, then you can't use your funding for consumable items. So it has to have something in there for it to be flexible, if that makes sense and not too confusing. When it comes to capacity building, then there are many subcategories. It's not as flexible between the subcategories. Actually, it's not flexible at all between the subcategories, but there is some flexibility within the subcategory. So improved daily living is the most popular, the one that's in pretty much every single person's plan. And that's your therapy budget. So what I mean by flexible within that subcategory means that unless the amount says next to it, unless it says occupational therapy, this amount stated in the plan, which means you can't use it for anything else other than occupational therapy. And this is rare to have it like that. They'll often list what it's for, and they can even list the amounts that they built in. So it shows how it came to that amount. But within that improved daily living budget, you don't need to use the occupational therapy exactly to the dollar of that amount. You've got that amount of capacity building improved daily living or therapy budget, to say it's 20 grand, to use it for allied health professionals that are in line with legislation. So in line with your goals, your disability, your helping to build your capacity for social and economic participation, taking into consideration all of the other supports in your life. If that's the case, then you are able to use it. So say it says $1,500 for occupational therapy, but you want to use $2,500 of that improved daily living budget for occupational therapy. That's okay, as long as it doesn't say stated next to it. And one that often says stated is your improved relationships budget, and or your support coordination budget. And that improved relationships is for behavior support, and support coordination is for support coordination or psychosocial recovery coaching. So you often find that in capitals, it will say stated on that left-hand side of the plan. And that's what that means. It can't be used flexibly for anything else. Under capacity building, you'll also find there is also a social, community and civic participation budget. And that is for group programs that they tend to say are overseen by a therapist, sort of like group therapy programs that are social in the community, but it doesn't necessarily have to be overseen by a therapist from that budget. But if you're using it in the improved daily living budget and it's a group therapy program, you want to see that there is a therapist overseeing or facilitating that program. And each category, so with the plans being managed, how they're managed, so they can be self-managed, plan managed, or NDIA managed, but don't assume that your whole plan is the same, managed the same way. So if you've chosen to self-manage or plan manage certain parts of your budget, then hopefully they have approved that and that's in there. But just have a look next to each budget and amount. It will say whether it's planned, self, or NDIA managed. If it's self-managed, then it's you're paying the invoices. So you can either get an invoice, have 7 days to pay, request the money on the portal. So if it's your first plan, you need to make sure if you've got transport allowance or you're self-managed, you need to make sure that the NDIS portal is set up. that your bank details are in there. So under your details, I think that's the tile, your details, down the bottom, it should say my bank details, and you can put your BSB and account number in. That's the money that transport and any self-managed funds that you request, that's the budget, that's the account that it's going to go into. So, and you can change it at any time. So you would be getting an invoice requesting the money from the agency that comes into your account within a couple of days, and then you can pay the invoice, or you can pay the invoice and get reimbursed. It's good to keep receipts and or upload them, or keep invoices and upload them. Because just in case for audit purposes, but also just it's best practice. If it's plan managed, then before you start any therapies or any support workers or any cleaners or anyone, then you need to set up with a plan manager. So it's pretty easy. Mostly you can do it online these days, and there are many out there. It's about personal preference. Some places have a portal, so similar to the NDIS portal, but just for the budgets that are plan managed, where you can see the budget, you can see the invoices coming in, and you can monitor it that way. And so you need to set up with them first before using any service. And if it's NDIA managed, then the invoice needs to go straight to the agency. Self and plan managed, you don't need to use registered providers, but NDIA managed you do. So if, for example, your improved relationships budget is NDIA managed, then you can only pick a behavior support clinician that's registered with the NDIA. And most are when it comes to behavior support clinicians, but not all. So definitely ask the question. When it comes to setting up with a support, the plan manager or the support coordinator needs your entire plan. Therapists and other providers for, gardening or support work, they don't need your plan. So they will your entire plan. They'll want to know your plan dates, your goals. They might ask for your entire plan, but you absolutely do not need to share it. But you can just tell them, this is how many hours that I have and would like to use on your support. Then we've got capital. So under capital are things that are your mid and high cost AT. So in the core budget, that's where you find your low cost assistive technology. Consumables budget is where it comes under. In your capital budget, that's where you find mid cost and high cost. Mid cost is a fairly new thing in the last couple of years, because the NDIA were finding that if it wasn't low cost, it was high cost, and a high cost needs a big report and a quote and everything, and they weren't getting to them quick enough. So by the time they were reviewing, the assistive technology team were reviewing them, they needed a new quote because it only lasted a few months. So they've brought out mid-cost assistive technology, which you can use your low-cost assistive technology out of your core, or your mid-cost assistive technology with getting a quote and a letter from a physio or an occupational therapist, depending on the piece of equipment and who's most appropriate to comment on it. The recommendation letter. Even if you're self-managed, I recommend having a recommendation letter. I know it's annoying, but they can do them pretty quick, and it is best practice if you're audited. So if you're self-managed and you're just purchasing mid-cost AT or low-cost AT out of core and you get audited, they're going to have a lot more questions if you don't have those recommendation letters. High-cost AT also comes through the capital budget, but it needs to have a big report and a quote and takes longer to get approved. Home modifications and specialist disability accommodation, you'll also see funding under the capital budget if it's most appropriate. Home modifications, you might see that they build in a small amount like $1,500 or $3,000 or $5,000, and that's for you to get a assessment from a builder, a quote and everything to submit to the NDIA to get the actual money in for the home mods. When it comes to your assistive technology, you might find that it's the equipment that you've requested has been listed, and next to it says a quote is required. So they've had a, it might be that there's been a recommendation or something, but there's not been a quote. They need the quote to then know how much money to release, but they've essentially built that equipment in behind the plan. It's sitting there, but they're just waiting for the quote for it to be released, and that gets released to the provider that provides the quote, that gets ordered and then delivered. So that's what that means when it says quote required. It may also say stated, which means you can only use the amount for that amount. So that's what you need to look for when you're looking at those things in the plan. So how to use the funding appropriately, obviously having a good understanding of the budget, how you can utilize it, what the categories mean and everything is key, but you don't always get that from an implementation meeting with an LAC planner or a support coordinator. So asking more questions and asking for it to be sent to you. If it's an LAC or a planner, say, can you please send it to me a summary of today's implementation meeting in writing? Then you can refer back to it, and it will say sort of, this can be used for this, this can be used for this, this is what this means. And but definitely have a good read, highlight the areas that are confusing, ask the questions and ask them to write it down for you so you can refer back. If you don't have a support coordinator, when it comes to, say you've got and your plan managed, when it comes to, a lot of people have difficulty with the low cost assistive technology section, but when it comes to say that in your core budget and what can I spend that on, you can ask the plan manager. I recommend when it comes to low cost assistive tech, or even a sort of a service or support that's not necessarily listed in the plan on that left-hand side, or is a bit left field, check with your plan manager first before starting sessions and get that pre-approval in writing. And also just to say that, just checking that I can use this support for my through my plan. If they write back and say, yep, absolutely, no problem, you've got it in writing. Then if another, if someone else in the team comes back and questions an invoice, but they might come back and say, yes, potentially, but you need to get confirmation from your LAC or planner. So it would be about going back, always get it in writing. So always ask for them to write you an email to say that you can spend your money on that. When it comes to low cost assistive tech items or consumable items, so that might be continence aids and things like that. But especially for low cost stuff, if you're unsure, and you always get a recommendation letter and a quote and get it approved by the plan manager before. If you're self-managed with that, you can just go and purchase it. But if you're unsure that the plan manager or the NDIA are going to approve it, try and get pre-approval for it by sending it to them prior to purchase. And then if you've got that pre-approval, then you can go back. You can purchase it with the ease that they're going to give you the money back. Sometimes I say to people, if you're going to buy it anyway, go buy it. And then you can put the receipt in. If the NDIA, if they approve it, great, you get that money back. But if not, it's no big loss because you were going to purchase it anyway. So it's completely up to you how you want to do it. But I would always err on the side of just checking and getting that confirmation in writing, because that will also help with the auditing. It's important to have a really good understanding of reasonable and necessary. I know the legislation is super long. If you're going to read any part, read section 34. Also, the NDIS rules help to break down section 34 really well. We'll include all of these as resources with this webinar, but it is good to have that understanding, because then when you're thinking about a support, and sometimes like I'll say, okay, let's go through the reasonable and necessary checklist with someone I'm working with. If they're saying that they want a support funded and they're, really gung-ho on that happening, I say, okay, let's go through it together. And I get them to provide me with their justification of why, like how it links to each of the points. Sometimes they can be really creative. And so I sort of have to be like, okay, but we need to be sort of serious when it comes to that, because if you are audited, or if you need a recommendation letter, or if you need to justify it to the plan manager, you're going to have to provide those explanations. So it's good practice, but it's good to think about your supports in that way. It's also really good if you've had a plan for a number of years and you just go, oh yeah, I'm just going to keep my supports exactly the same. It's actually really good to go back to the reasonable and necessary checklist, which refers to your goals. So then reflecting on your goals to say, what is this support doing for me? Is it still helping? Are we working towards goals, or are we stuck? And there is absolutely no problem, or like you have every right to change supports anytime. And so if you don't feel like you are working towards it's kind of helping you, then you should be looking at alternatives. So it is good to have a good reflect, even if you've had a plan for a number of years. And a lot of people come back to me and say, oh, but this person uses their plan on this. And I'm like, okay, cool. But it's your plan is your plan, and it's built for you. So when it comes to, yes, there are guidelines, and yes, there are things that NDIA do not fund and do fund. And they're black and white about that. There are so many gray areas when it comes to NDIS, but there are clear guidelines around certain things. So like anything medical cannot be funded. That's all health. So that's mainstream. TAFE, uni, workplaces have an expectation to provide a level of reasonable adjustment. And so the NDIA aren't going to fund everything. But say you're in the workplace and you need some equipment for your computer or something to be able to do your job. That's the workplace's responsibility. If you are needing support to go to the toilet or eat in your workplace, that is NDIS's, due to your disability, that is NDIS's responsibility. Another key point that I should have mentioned before is and I'll bring it up again, but when I say links to your disability, that isn't just, you might have a list of diagnoses, but it's the ones that you have met access to the scheme for. So it's not in the NDIS plan, which I've said for many years it really should be, but the NDIA, it will be in your decision letter. And you can also ask the LAC, what are the disabilities that I've met access for? It doesn't matter if it's secondary or primary, but as long as you've met access for it. And so the funding needs to be used only for that. So if you've got physical difficulties, so say a sore back or something like that, and you want a piece of equipment, but you've met access for a psychosocial disability, you can't purchase equipment for your back through the NDIA, nor can you go to the physio so it needs to link to the disability you've met access for. So yeah, when people say that that someone's got funding for this, that is their own plan. Plus, they might not necessarily be using their funding appropriately. So there's a lot of people that have come back and said, oh, people get this funded, but And I don't know that situation, so I can't comment, but there are certain things that are black and white. Like they might say, oh, my friend purchased a TV. Absolutely not. NDIA won't fund that. That's considered a everyday expense that anyone would purchase. And that's by choice as well. So NDIA aren't going to fund a TV. So if someone's purchased a TV through it, it's typically the wrong thing to do. So, but it's not my place to comment, but I will just bring them back to, this is your plan. This is what you can utilize your plan for, and this is why, and go back to reasonable and necessary. So I just been talking about it, but we'll go through each of the reasonable and necessary points because I've brought it up so many times. Just to summarize, the NDIS funds a range of supports and services, which can include education, employment, social participation, independence, living arrangements, and health and wellbeing supports. But in order for it to be considered reasonable and necessary, a support or service must be the following. It must be related to the participant's disability that they've met access for, like I just explained. It must not include day-to-day living costs that are not related to your disability support needs, such as groceries, rent, bills, TVs, trampolines, things like that. It should represent value for money. And what they mean by value for money is that out of all of the options, it should be the most cost effective. So it doesn't necessarily mean the cheapest, but it means the most cost effective for the into what you're using it for. So if, for example, a person is living independently, and if they have a piece of equipment that's, say, $5,000, but it allows them to do say it's a wheelchair, but and that allows them to mobilize within the home and the community independently. That's a lot more value for money than having a support worker there. They might need a support worker as well. So it doesn't necessarily replace one or the other, and that needs to be considered. But if it's something that will build the independence of the person, will mean that it costs the agency less. And assistive technology, they are really pushing that in the home and living space. So is there any assistive tech that can be implemented in the home and living environment that will mean that the person can cook themselves, or make a cup of tea themselves, or go to the toilet themselves, or go to the shower themselves, which will reduce the need for a support worker being there? They're going to fund that over that. So when it comes to value for money, it's not necessarily the cheapest option, but it's the most cost effective. They also want to see, ideally, that supports reduce over time. So value for money can also be an argument made about that. You fund this now, we build the capacity, supports reduce over time. That's going to be the most cost effective option. So it can be in that people can make. But that's not necessarily useful for all people with disabilities. That's not how all disabilities work. So, but the NDIS rules explains value for money quite well. It must be likely to be effective and work for the participant. So it needs to be evidence-based. And that's where assessment and justifications and supporting documents from therapists recommending and assessing, so backing up what they are recommending through the report, can help. But when they say it's likely to be effective and work for the participant, also when it comes to, if you've had a plan for a number of years, when it comes to each plan review, and I know there's a lot of rollovers happening now, but if you've got a plan review, and even at a rollover, I think it's still best practice to collect your summary reports from the therapist, because otherwise therapists are just going to get lazy, and it's actually useful to reflect on the progress that you're making through the goals. But also when the NDIA do come after a couple of years and say, we need to justify this funding, is it still working and everything, you've got evidence to back you up. So a progress report shouldn't be 30 pages long. It only needs to be a couple of pages long. But one of the key parts of it is that they go through your NDIS goals. They break down what therapy goals that you've been using in relation to the NDIS goals, the progress made, and the next steps. That next steps is really important when it comes to likely to be effective. Because if you can show that there's been progress, but there are next steps, then the support is easier to justify, to say that we can see that it is working for this participant, and here are the next steps to help to achieve this bigger goal. And then it should take into account support given by other government services, family carers, networks, and communities. So that's informal, mainstream, and community supports. So there can't be any duplication. So an example of that is if a person's in hospital, NDIS do not provide support. There is a little bit of leeway there around social support because the hospital don't necessarily provide that. But when it comes to, you know, day-to-day support, like support with showering or dressing or things like that, that's all the hospital. It's a duplication if there's support workers coming in doing personal care stuff. That is the nurse's job. So it needs to take into consideration that. It needs to take into consideration TAFE's role, uni's role, school's role in their reasonable adjustment. So it can't be a support that is actually something that they need to pay for, whether it's a piece of equipment or what it is. It needs to take into account informal supports, but within reason. So under 18, a lot of people are aware that it's really hard to get support worker funding. As you get, when you're really young, pretty much impossible. As you get older, it's a bit easier. And then as an adult, it's easier again. The reason for that is that it is, they see the level of parental responsibility and they're assessing that. The argument there is that if you can provide the argument that a typical developing person the same age as the participant that doesn't have the disability requires A, B, and C from their parent. I'm providing, you know, A, B, C, D, E, F, G to the participant due to the functional impact of their disability, then you can separate what is reasonable to expect from informal supports and what is beyond that, and that is due to the disability that they've met access for, and therefore you've got a stronger argument to fight for something like support workers. They'll push back on informal supports all the time. But after a person's 18, it is not reasonable for them to push back, but they will. They'll also push back on partners doing certain things, and it is completely inappropriate. So it's fine to argue that point and push back to them as well. But if you've got a really good understanding of reasonable and necessary, when you're requesting a support and they try and push back, which they will do, and if you're not in there with a support coordinator or someone that knows reasonable or necessary, knows legislation, they'll very easily sort of go, oh, it's not reasonable and necessary. If you've got an understanding of it, then you can go back to them and go, actually, no, I believe that it does. And you can list it. And you can list your justification as to why, and you're going to gain a lot more respect really quickly. But also you've got every right to push back and say that and not be intimidated by their use of language. Also, if you're in a meeting, whether it's a first planning or a fifth planning meeting or a review meeting, and they're talking in a lot of jargon, you can actually stop them and go, I don't understand what you're saying. Can you please break this down? You're speaking in a lot of NDIS jargon, which is very unclear. And they'll often do it to intimidate, but they won't necessarily be talking much sense, even in NDIS land. So they'll say it all so people go, oh, yeah, okay, I believe what you're saying. But you can question it at any time. And I encourage you to, if you're not really understanding what is being said. The supports need to help the person pursue their goals. That's a big one. So we need to make sure that the goals, when you're thinking about the goals, you want to think about the supports you want to request and make sure they align. So if you've got some supports that don't align with any goal, make another goal. If you've got like say 4 goals and it covers all of the things you want to request, you don't need any more goals. So just have it kind of next to each other when you're preparing. It needs to support increasing the person's independence, their community and workplace participation, or their study participation, or maintaining it. And workplace or study might not be possible for the person, and that's okay. It might just be about increasing community supports and develop their capacity to actively take part in the community. What the NDIA, they're obviously an insurance scheme, but they are a capacity building scheme. That's what they speak a lot about. And so when what they want is they want to see supports reduce over time. So if the so that's why we want to show when it comes to reasonable and necessary that these things are in line with helping support build capacity for that. But you can argue if a person has a disability, a diagnosis, that the nature of it is going to decline, they're going to decline, or the nature of it means that it's just about maintaining, then that is okay too. So the other thing too that's helpful to look at, and I know it's a bit annoying, but it's the price guide and price catalog. The price catalog is just a whole lot of item numbers, so you can't really decipher that, but it is good to have that in the background. But reading the price guide can help you with understanding what an item code can be used for. So there's some that are really vague, and then it'll explain it. So skill building, for example, under improved daily living budget, what does that actually include? In the price guide, it gives you an explanation. If there's a group program and they say, oh, we're funding under program of support, and it's like, what is program of support? In the price guide, it explains that. So going through and having a look at the price guide, whether it's referencing something when something's come back, or whether it's just having a general understanding, can be really helpful. And so if you're wanting to utilize your plan or to purchase a piece of equipment and are unsure whether it will be approved, I recommend that that you speak to the plan manager first, like I explained before, and then like I explained before around the invoice and receipt. And if it's something you're going to purchase anyway, then that might not necessarily be something that you worry about, but if it is something that you definitely want money back for, getting that pre-approval is helpful. So choice and control. This is something that the NDIS really set out to, they use it all the time. And when the NDIS started, they spoke a lot about it. What does it mean though? So some people will use it, like they'll say to me, yeah, but I've got choice and control. It is still within reason and within guidelines. So what they mean by choice and control is that the previous previous sort of block funding programs and stuff didn't give a lot of autonomy or choice in the funding, who you used, what you used it for. So that's a big one. So in comparison to previous block funding community supports, there's more choice here. So you've got more autonomy over the supports and services that you use to meet your needs and goals within the NDIS guidelines, within reasonable and necessary. You've got choice to select the service providers, and for self and plan managed participants, and you can choose how you manage your plan, so that gives you also choice, but you can choose whether you use a service provider that's registered or unregistered, and you've got choice over what you do with that provider. So you can, which goals you work on, what you break it down to be, what you do day to day, you've got that choice. So they talk about tailored plans. So each plan is individualized based on the specific circumstances, preferences, and aspirations. And the goals, the participant has the choice to set their own goals, which is essentially going to be really important in how the plan's used. So when they talk about choice and control, that's what they mean. They also mean that, like I mentioned, you have the choice of how you manage the plan, and you have the, I guess, opportunity to be empowered around informed choice and skill development. So you're encouraged through the LAC or support coordinator to help to build your understanding to be able to navigate the system. They've got the app, they've got the portal on through MyGov. They have a lot of resources on the NDIS website, which is actually, there's a lot of great resources on there. So they do encourage that skill development, to have that understanding, to have more choice and more control. And what I was saying before about you anchoring yourself or having those tools in your toolkit of understanding legislation, understanding the price guide, having the really thought about your goals and everything. When you come to a meeting, you're sort of armed a little bit, I guess, when you're making your argument. So when they talk about choice and control, that's what they mean. So plan flexibility. So I get a lot of this of, oh, well, I'm just going to use my plan how I want to use it because I have choice and control. And when it runs out, I'm just going to get a plan review. Not really how it works. There are still limitations when it comes to plan flexibility. So what I was explaining before about the budgets and flexibility within the budgets, that's what they're talking about. Choice and control is what I just spoke about. The NDIA are essentially an insurance scheme, so they have to have evidence backing up funding requests. So that's why supporting letters, reports, for reviews and everything is really important. They are bound by legislation. So when a plan's built and utilized, they need to adhere, and we all need to adhere and respect the legislation. It doesn't mean just using your plan however you want and overutilizing your budget because the NDIA is just going to give you more and more. They're less likely to do that now. And they are actually, when there's overspend, if we find that there is overspending and there's a reason for it, then we can reassess the budget, we can reassess the situation, we can put in a change of situation. What we need to be aware of is when we put in a change of situation now, any change of situation that's put in, number one, there's massive delays at the agency. Number two, every plan that there's a change of situation, it is audited. So when there's any overutilization of the plan, that will be really heavily looked into. So it's not just about kind of overusing the plan and getting more or getting it topped up, as people say. So when you receive your plan, you've got the option. So they'll tell you, the LAC will tell you, the planner will tell you, the support coordinator will tell you, you have an option to review the decision. But it's important to really understand the plan first. So a few people will come back to me and they'll say, I've got my plan, but it's wrong. Like, I want to review it. But when we sit down and actually go through it and implement it properly, and I explain each of the budgets, they go, oh yeah, no, it's fine. So understanding the plan first before jumping to reviewing it, because people go, oh, I'm just going to review a plan and I'll get more money. Not necessarily. You can review the plan through an internal review, and you could get more money, but you could actually also get less. It goes to a different person to review it, a different planner or a delegate to review, and they will make their own reasonable and necessary decision. It is important to provide additional evidence, depending on why you're like what it is. If there's absolutely no additional evidence that you can possibly provide, okay, but it's best practice to try and provide additional evidence. You've got 90 days from when the plan's been approved. You can utilize your plan as normal through that period of time. So you can get reports and things like that, and then you can submit it. So you'll submit it. What I recommend, if it's a change of situation or if it is a internal review, submit it through inquiries, the evidence and the form, the internal review form, which we'll put in the resources, but call them. Give it a couple of days so it can actually arrive in the inbox, but they are so enormously delayed at the moment. Give them a call and tell them what email address you sent the information, the request and the supporting evidence through to. Get them to do it verbally over the phone and attach it to your file, because it will be, then you're not waiting for, 3 weeks to a month of it sitting in an inbox for people to actually get to it. You've called them and you sort of jump up a little bit in the waiting queue. Outside of the 90 days, or even inside of the 90 days, if it's appropriate, you can put a change of situation. So if there is a change of situation within that 90 days or even after, you can put in that. So a change of situation can be small or big. You can request, I think I've got a slide on this. Yes. So the NDIA say that they always need to hear about the changes to your circumstances. And here's what, some things that it includes. If you are, if you have some of these changes like contact details and stuff, you can just call the NDIA and change it. If it's something that is meaning that you need to get more funding, then you need to provide evidence, but also you provide the change of situation form, which we'll add. And you've got the option in the form to request a plan variation or a plan reassessment. The plan variation means 1 to 2 small changes, and a plan reassessment is reviewing the entire plan. Again, you may not necessarily get more money. So just being mindful of that, and you need to provide evidence. The other thing that a lot of people have this knee-jerk reaction of, oh, my situation's changed, I need to put in a change of situation and get more funding or get different funding. I advise you to reflect on the funding that you have. Is there any way of flexibly using it so that it does work? Because if you've got a good, healthy plan, and there is ways, then you've got more, you may as well hang on to that as long as possible. But if it absolutely is not working, go for it with the change of situation. They don't have long to review a change of situation form, so it doesn't need to be pages and pages long, but it does need to summarize and then backed up by the supporting evidence. If you're going for a home and living decision, then the home and living form needs to be completed. There needs to be an occupational therapy home and living report and a change in situation form completed to submit. So there are a number of reasons to do a change in situation, and they do list them. So in the change of situation form, you'll see what is the change? Is it that you need more supports urgently? Is it that you want to change your goals? Is it, so you can tick what it is and it will tell you which section to fill out. So you don't need to fill out the absolutely entire form. So it is pretty clear. And so yeah, so what I just explained, there's this knee-jerk reaction, and sometimes it will come from therapists as well. You can notify the NDIA, but you don't need to change your plan. You can say, my plan still works, just want to notify you of this change. Putting a request in for more funding doesn't necessarily mean you'll receive more funding. And it's important that you've utilized all mainstream and community supports. So because NDIA is not a one-stop shop for everything. And when they review the plan and go through a change of situation, they're going to ask you, have you used all of what you can informally, mainstream and community? You want to be able to say yes to that, otherwise they'll knock it back. So if it's a home, like if it's a housing situation and you're not able to live at home anymore, is there temporary housing that you can explore, and is that suitable? And if not, giving a explanation as to why, getting a report from an occupational therapist to pretty much rule out those mainstream and community options as being options. So it's really important to provide, because it's an insurance scheme, to back up what you're saying. So due to the changes with PACE and NDIA, they are experiencing massive delays. It's 3 to 6 months for an outcome. When you call the NDIA, it's even on that intro message. There's more flexibility within the plan budgets at the moment because of that. If you need to submit it, it's worth calling after a few days, like I said, to make sure they've received it and are processing. And after 21 days, you can escalate. What they are doing now is that for high risk cases, you can escalate. They will see that. You can put it in a complaint to bill shorten. You can do all of those things. But what they see as high risk is obviously if there's a dangerous situation, or if the budget's with under $1,000, then they're looking to put, and people are waiting on an outcome. They'll keep you on the list for having a reassessment. So you'll still have a meeting to reassess your plan, but they'll give you an interim plan. So that it'll be 12-month plan, but you'll remain on the list for having it reassessed. So it should only be a few months, 3 to 6 at max, that you're waiting, but you have funding to use in that time. So the other thing that I wanted to mention, and I know we've gone over a little bit, but 3 months prior to the expiry of your plan, you'll receive a phone call. Some people get really confused by this phone call because it is confusing, or a letter. The plan, it'll say that your plan's coming up for review. They'll say in the phone call or the letter what you're eligible for. And you've got 3 options. There's a plan rollover. This is the same plan again for 12 months. There's a plan variation, which is 1 to 2 small changes. There's a plan reassessment. You can you can request a plan variation or a reassessment. The rollover, you can't really choose. You can ask for, but they will assess whether if you've had your plan roll over a couple of times, they're not going to roll it over again. You're going to have a meeting. But if you're eligible for a plan rollover and you want one, then take it. You can contact or respond with what you'd like to happen. If you don't say anything, they'll just make the decision. So they'll just make the decision to roll over the plan. So if that's an option. So if that's the case, but you don't want to roll over, you need to call them and tell them you don't want to roll over and you want a plan reassessment, or you want a meeting to discuss some small changes. It's important to get reports, and it's not, and if you have a support coordinator, this is helpful for them to do, but it is important that when you receive reports, have a look at them, make sure they are in line with reasonable and necessary, that their recommendations justify it based on reasonable and necessary. So they write a few sentences about why it's reasonable and necessary, that through the report, they are talking about the disability that you've met access for, and that it is, so they're not talking about, say, a medical condition, because the NDIA aren't going to fund that. They're just going to push it back on health. So don't just receive a report and go, oh, cool, I've received a report. Make sure you have a check, and you've got every right to go back to them and say, oh, are you able to adjust here or adjust there? All right, we've come to the end. Sorry, I've gone a bit over. Ali, are there any questions in the chat, or yeah, is there any?
Thanks, Alex. No, we haven't had any questions through the chat so far. So if anyone does have any questions, either feel free to jump off mute and ask them yourselves, or put them in the chat, whatever you're most comfortable with.
Hi, it's Tracy here. Can you hear me? I have a question regarding, so when your participant has first gained access to them and they were to the NDIS, and then they've been on them for, say, like 8 to 10 years, and they've gone through childhood now to young adulthood, and they're sort of, their primary disability is still the same, but then other disabilities come through. Do you need to be reassessed and gained access again to actually, so that you're getting funding to actually cater for that is extra?
Yeah, that's right. So there's a couple of things that have happened, and I did a webinar on access, and this actually covers it, but just in summary, but you can have a look and watch it. But a number of people came over on the scheme as a defined participant. So they were in other disability services and they came over. One of the things that other disability services did not cater to was psychosocial disability. That is NDIS only. And so there's a lot of people that have psychosocial disability, for example, as an additional diagnosis that impacts them day to day that they need to add. So what you do is it's similar to the access process, but you don't need to go through the full access process. So if it's psychosocial disability, the psychosocial disability form needs to be filled out. If it's another diagnosis, having a diagnosis letter and supporting evidence for that. So going into the domains, the 6 domains, so mobility, communication, social interaction, learning, self-care, and self-management, having the therapist go into, or the medical practitioner going into each of those domains, speaking functionally, and I talk a lot about it in the Access webinar, is important, but you can go to the LAC or the planner or submit through inquiries and put in a change of situation to ask for that disability to be added as an access met diagnosis, which is absolutely correct. It is really important to do if that person is needing support for that. And you, like, say they have psychosocial disability, but then they have a physical disability, you can't get funding for physical disability without it meeting access. So you got to go back through the process, but it's not as kind of lengthy. You just got to provide the supporting evidence to the LAC or the planner or inquiries, give them a call through a change in situation, and it'll go back to the access team, but they can add it. If you're doing it for the purpose of they need a certain support, so say they need a home and living option, that they're exploring home and living options, and through the whole report they need it because of a disability that they have not met access for, it is better to go and meet access for that before submitting all the home and living stuff. So do that first, have it listed, because it's 2 different teams assessing it. So if it's not on there, but yes is the short answer, it's definitely important to do.
Great, thank you. I'll check out that webinar.
No worries.
Fantastic. I've just popped the link to Alex's Access webinar in the chat if anyone is interested. We had another just comment come through from the Boland family saying, it blows my mind that young people who are turning 18 and leaving school with significant supports have to fight for a plan reassessment.
Yes. It's so like transition, as in leaving school, is a big one, and 100%. It didn't used to be this hard to fight for it. It used to be quite simple. If the person was leaving school or had another big transition coming up, the NDIA would recognize it and reassess quite easily. Now they are so behind that they will push back whenever they can. But it is really hard. I speak with people at the agency all the time. It is really hard to be in this space at the moment. And they do acknowledge that the system is very broken right now, but they are hoping that it will be much better in the next 12 months. So it's about hanging in there. But you definitely, just so you know, you definitely have every right to reassess the plan if a person is leaving school. And I acknowledge that it's a really scary, it can be really scary and anxiety provoking for participants and for their families. Ali, as well, if I wanted to say, guys, if you have a look on the Fighting Chance website under resources, I've done a number of webinars, and so have previous colleagues. So there's quite a bit on there. But if there's anything that you want to hear about that you haven't heard, or there's no webinar on, please just email, because we're always open to talking about what the community kind of wants to hear about in the NDIS space. So please feel free to provide that feedback. I'm going to stop recording now.